Good morning. I talk about pulmonary artery. The pulmonary artery is a blue vessel. Histology is composed of an inner tunic, an elastic membrane, an outer tunic, and middle tunic. At the level of the arch of the aorta, the pulmonary artery is divided into right and left branch, one for each lung, which pass along the respective bronchus, lumbi, and penetrate pulmonary ileum. Then it is divided into finer and finer branches. Its function is to carry blood from the right ventricle to the lungs to be oxygenated through the alveolar capillary barrier in a process known as hematosis. The blood flow from the right ventricle into the pulmonary artery is regulated by the pulmonary valve. The symptoms are variability during physical exertion, fatigue, dizziness, fainting, edema, skin and blue leaks, chest pain. In Ecuador, using oxygen anticoagulants as sodium warfarin diuretics in atopic agents. Surgical therapy in Ecuador are pulmonary thrombus and endarterectomy is when excised bloody clot in the pulmonary artery. It can be surgical removed to improve blood flow and lung function. Lung transplantation is most common, or heart lung transplantation is rarely. Pulmonary valve transplant and catheterism is other option. This maintains the susceptibility to various diseases. Thromboembolism occurs when the valve cannot open enough, and as a consequence there is less blood flow to the lungs. The hemoglobin can also occur just before or after the valve. The treatment is to pass flexible tube catheter with a balloon attached to the extreme of the hair. Special X-ray are used to irrigate the catheter. The balloon expands the valves open some paintings magnetic hair surgery to repair or replace the pulmonary valve. Thromboembolism. The pulmonary arterial obstruction is caused by deeper left thrombus in situ. It is a potential fatal disease. The arteries carry blood from the heart into lungs, become narrower than normal, hindering blood flow. The vessel is in usual course and now, and the result in hypertension pulmonary. The result is too much strain on the right ventricle of the heart, causing to enlarge in the side and gradually weakens and lose its ability to pump enough blood the lungs.
Primary pulmonary hypertension is an extremely rare lung disorder. The blood pressure in the pulmonary artery rises far above normal levels for no apparent reason. The pulmonary artery carries blood from the right chamber of the heart to the lungs. Patients who suffer from pulmonary hypertension have blood pumping through their pulmonary artery at more than double the rate of healthy individuals.
We think pulmonary hypertension starts by the cells that line all the tiny blood vessels in the lung. And so the lining cells go from being a nice smooth surface to something disrupts it. So then the muscle starts to close down on the artery, and the arteries then start to scar closed. So over time, the vessels go from being pretty wide open to being virtually totally closed. And so the pressure to get the blood through those arteries builds up, and it becomes extremely, extremely high.
This closure in the pulmonary artery puts an enormous and sometimes deadly strain on the right chamber of the heart, which must now work harder than usual to move blood through to the lungs.
Fast occlusive thrombus, vasoconstricted vessel. Acute coronary syndrome is very different from stable atherosclerotic disease. No wonder that conventional balloon expandable stents show a higher frequency of adverse events in the early phase of ACS treatment. These two IVUS images of a real acute coronary case show from inside the vessel lumen how a stent which appears well deployed on the left-hand side resulted in a gap between the stent and the vessel wall after 13 months, as shown on the right-hand side. How could that possibly happen? First, as the balloon that delivers a conventional stent is deflated, the stent's natural tendency for recoil could result in initiating such a gap between stent struts and the vessel wall. Second, as the vessel relaxes, vasodilatation increases, resulting in further expansion of this gap. And finally, as thrombus dissolves over time, the gap between the struts and the wall becomes even larger, and hence increases the stent's malapposition. Malapposition is the primary predictor of stent thrombosis. Floating struts disturb blood flow and increase thrombotic risk. With conventional stents, malapposition is induced by stent recoil, vasodilation, and thrombus dissolution. Stentis is bringing a simple solution to the treatment of acute coronary syndrome. The Stentis platform is a self-expanding stent platform that builds on the superelastic properties of titanium alloy. It is gently and easily deployed over the thrombotic lesion by retracting a protective sheath, and because of its inherent design and properties, it exhibits no recoil. As spasm is relieved, the vessel diameter increases, and the stent follows in expansion and continues its scaffolding of the artery. Finally, as the thrombus dissolves, the stent expands further to absorb the gap left by the dissolving thrombus, thus maintaining a perfect apposition throughout the remodeling process of the vessel. If the Stentis stent is deployed across a significant side branch, and if access or treatment of the side branch is desired, a guide wire and a balloon are advanced through the stent mesh and into the ostium of the side branch, as would be done with a conventional stent. Rather than deforming the conventional stent struts, the balloon inflation gently separates Stentis proprietary connectors at low pressure, thanks to a combination of flexion and rotation. This allows the free mesh to cover the side branch ostium. The wide opening provides uncompromised access to the side branch for optional further treatment. The shape memory properties of nitinol make the disconnected ends return to their initial position and safely appose to the vessel wall.